Okay, this video is part number 6 of Is Psychiatry a Joke? And we're going to talk about Peter Breggin today. I think it's good to know the actual people who wrote and did these things. I'll show you his book. I'll show you a picture of him. I'll put a link to one of his lectures, because when you learn about the people, like to learn something in a biographical sense, it's more memorable. It's like when you learn history. If you learn about the historical characters, it's much easier to remember what happened compared to just the dry factual data or dates and whatnot. So anyways, I'll show you all about Peter Breggin. He's considered the greatest psychiatrist who ever lived. Okay, so this is a picture of Peter Breggin as well. He's given a lecture through Telly. That's the lecture I'm going to link to. He wrote a whole bunch of books on psychiatry. This is his best book right here, Brain Disabling Treatments in Psychiatry. And I'll quote you a line. He trained at Harvard, by the way. He's brilliant. He's super nice. He's just a good person. He never prescribed psychiatric drugs. He's a psychiatrist who never prescribed psychiatric drugs, except, he says, when he's weaning a patient off a medication, to taper the dosage down. And he does acknowledge that sometimes in an acute setting, let's say a patient's having a psychotic episode that's a real problem, you can potentially use them in that short, brief setting. He says all psychiatric drugs cause brain damage. He said every single one of them. He says they're all essentially a chemical lobotomy. He says electroconvulsive therapy is an electrical lobotomy. And of course, there are surgical lobotomies. He did a lot in his own career to try to prevent the continuation of surgical lobotomies. And he'll go on and on about every single category of drugs in great detail, but just a few quotes from him. Lithium, for treatment of bipolar is a severe brain poison. Here he is on antipsychotics. He says they kill brain cells. There are chronic blockade of dopamine type 2 receptors, D2 receptors in the striatum. It results in permanently enhanced release of glutamate. Well, there's the perfect definition of an excitotoxin. Enhanced release of glutamate. This is stuff I'm talking about. That's why also you want to know about my theory of neurodegeneration, neurovascular uncoupling, where the stimulant effect is greater than the oxygen and glucose compensatory effect to keep them coupled, the amount of oxygen and glucose delivery relative to the metabolic rate of the neuron. That's the key thing to know about neuronal damage. Do not trust the textbooks. All medical textbooks stink. Anything in conventional medicine, I can tell you, after many years, I've been a doctor over 30 years, I've been studying this since I was 18 years old, I'm 60 years old, they all stink because they're all designed to sell drugs. They don't teach you what you need to know. Once you get that neurovascular uncoupling, you can understand tons of things about the brain. It's obvious what's damaging and what's not. You should also know dilatory theory, as we spoke before, multiple previous lectures about what causes dementia. Okay, so here's another quote about hippocampal neurons. Hippocampus is the main memory center in the brain, medial temporal lobe. He says, in hippocampal neurons, haloperidol, antipsychotic, dopamine blocker, typically used for treatment of schizophrenia, induces calcium ion influx into the cell, increases cytoplasm calcium. And this renders the neuron more vulnerable to oxidative stress. Yeah, it kills the cell through oxidative stress, and this all feeds into the same concept of excitotoxicity. Excessive calcium turns on the neuron, overstimulates it, and then you need lots of energy to pump that calcium out of the cell. But guess what? Haldol is a mitochondrial inhibitor. I showed you. It inhibits complex 1 of the inner mitochondrial membrane, electron transport, so you can't produce as much ATP. Well, then you don't have the energy to pump the calcium out. The neuron's screwed, okay? And then a lot of other things do that too. Selective serotonin reuptake inhibitors, antidepressants do that as well. Okay, a lot of them do. Sertraline, trazodone, a whole bunch of them, okay? Let's see what else. Benzodiazepines are like local anesthetics for the brain. The memory doesn't work so well. Withdrawal can be very difficult. He says in life, as humans, as psychiatrists, as doctors, as friends, we should try to be a source of friendship and trust, of support for other people. People do best when they are in an extended family type of environment. Humans are made for that. He says the most important thing is that the psychiatric doctor has a loving attitude towards the patient. And that's what I said. I'm telling you, if you really know medicine and you really know disease, you recognize that the patient has to come first. In conventional medicine, the patient does not come first. The patient, I said, is essentially irrelevant most of the time. What matters is, are you meeting the standard of care so you can't get sued and so you can generate a billing code and you get paid, okay? And that really, the standard of care means the lowest common denominator. It includes everybody. It includes all these demented, unconscious people, all right? Versus anybody who's conversant and has a little bit of brain capacity should want optimal care. But optimal care is considered irrelevant. It's considered an unrealistic goal. Okay, they always say it's genetic or the cause is unknown and therefore there's nothing you can do but treat it with a pill. Okay, what else does he say? He says that again, the doctor should be trying to help the patient regardless of whatever the rules and the formal requirements are, and that should be his focus rather than prescribing drugs or making money. He says the goal of the doctor, of course, should be a healer, not a drug dealer. So anyways, this guy is really good. He's the best psychiatrist. I read tons and tons of stuff about psychiatry, neuropsychopharmacology. He's the best guy. I'll put a link to him down below. You can hear his actual lectures. And like I said, this is his best book, but he wrote a whole bunch of good books on, different subcategories of psychiatric issues. So anyways, hope this is helpful.